Hello to everyone, and in this video we'll be discussing on the topic called as features in the clinical picture of lung tumors. So as lung tumors are very common disease in the section of oncopathology, and the most of the cases of neoplasm in lung tissues are associated with smoking. So who are frequent smokers or addiction to smoking, they are mostly prone to the cancer linked to the lung tissues, that is the lung cancer. Okay, now we have one syndrome in this section that is called as Gorner syndrome. It is Horner syndrome actually. It is also known as Horner-Burden syndrome or oculosympathetic paralysis. So in this pathology, there is a group of symptoms that are caused by violation of the conduction of the nerve impulse from the face and eyes and on one side of the body, that is called as paralysis. And this can also further lead as a complication to stroke and tumor, spinal cord injury. So these are the main complications which can occur in this. Now the patients with Horner syndrome will come to you with signs like miosis. The meaning of miosis is the constant construction of your pupils. The eye will be constructed constantly. Okay, miosis you will see, and you can see in this picture also. These are the symptoms of the patient with this is a miosis, constructed pupils due to denervations of dilator pupillary muscle. Okay, so the first sign you will see, and you can see in this images. Okay, these are the images of other signs. Okay, second we will see the isochoria, which is a noticeable difference in size. Okay, the size of the your lens or pupils. Okay, second we'll be seeing the ptosis, that is called as the drooping of eyelid, omission of the upper eyelid. So ptosis, you can see the eyelids will be drooping downwards. So in this you can see this drooping of eyelids here, this one. Okay, so you can see this. So ptosis is droopy eyelid, denervation of smooth muscle serving palpebra. So this upper part is called as palpebral part, in which we have palpebral muscle. Okay, so in that muscle the denervation, that is the nerve impulse, is absent. So that's why this drooping of eyelid occurs, due to no sensation there. Now we can see inverted ptosis also, and anhidrosis also. Anhidrosis meaning is that slightly sweating or absence of sweating on the affected side. The side which is paralyzed, on that side there will be no sweating. So in this you can see lack of sweating, degeneration of pseudomotor fibers. Okay, and in this hyperemia is also seen, and denervation of vasomotor fibers, and the pseudoophthalmos is a sunken globe appearance based on the ptosis. So these are the main sign you will see, unilateral or ipsilateral. So unilateral meaning is that on one side of the body, either it will present on the left or the right side of the body. Okay, so this was your Horner syndrome. Common symptoms, as I told you, you can see in this image also. This is the loss of sweating on the face. This first symptom, partially drooping of the eyelid. You can see the eyelids are drooped and the pupil will be small. Okay, as I told you, miosis, construction of the pupil. So that is the meaning of small pupil here. So these are the common symptoms you will see the patients with Horner syndrome. Second, we have the paraneoplastic syndrome, and this is a syndrome of complication of lung cancer, as it can cause difficulty in functions of different organs. So these are the signs and symptoms that occur as a result of damage to the organs and tissues in place from the site of primary tumor or metastasis. Okay, this much is clear. And now lung cancer can disrupt the functions of various organs, include neurological, endocrine, dermatological, hematological, ophthalmological, as well as glomerulopathy and coagulopathy. Coagulopathy and glomerulopathy together, it is called as Strauss syndrome. It is another pathology, but lung cancer can disrupt many functions of different organs, which can be neurologically, endocrine, dermat, skin, hematoblood pathologies, eyes, glomerular kidney pathology, and coagulation of the blood, that is called as coagulopathy. So these are the conditions you will see in the paraneoplastic syndrome. Okay, now we have some cancers related to lungs. We have squamous cell carcinoma, in which we will see hypercalcemia, main sign, and small cell carcinoma, you will see inadequate secretion of ADH, that's called as antidiuretic hormone. Okay, so this you will see in the paraneoplastic syndrome. Clear this much. Now we have to move forward to the types of lung cancer. I will discuss the lung cancer in detail here. So lung cancer we have two types, primary and secondary. So in primary we have two classifications, non-small, okay, non-small cell carcinoma and small cell carcinoma, okay, of lungs. So most common we have is the non-small, which is around 85% of cases. Small cell is about 10 to 15%. Now we have in non-small we have three types of cancers, that is called adenocarcinoma, squamous cell carcinoma and large cell carcinoma. So these are the three types which commonly occurs. So in adenocarcinoma, these occurs with a patient with non-smokers who does not smoke, often occurs in women, and the mostly located location part is small airways, small bronchi. Okay, so this is the adenocarcinoma. Second is the squamous cell carcinoma. It is out of 1/3 of the cases of total non-small carcinoma. That is out of 85%, 1/3 carries out to the squamous cell carcinoma, and it occurs mostly in the large bronchi and most common in men. So this is second type, and large cell carcinoma is not so common, less common, and it can be present at different location or any location. Okay, so these are the three types of non-small cell carcinoma of lung. In small cell, it is localized in large bronchi specifically, and exposure to tobacco or smoke. So the person who smokes, addiction to smoking, tobacco, they are prone to develop small cell carcinoma, and non-smokers are prone to develop non-small cell carcinoma. So by the name it is clear, non-smokers. Okay, so in this image you can see, in this image you can see I showed you the location. As I told you, small cell carcinoma are located on the large bronchi. So this is a large bronchi, this is a primary bronchi from trachea. You can see there's a trachea, there's a primary right and left. Okay, so it is in a large adeno, as I told you, in the small airways meaning in the distal part. Okay, and squamous cell carcinoma is present in the large bronchi. So it is also present in the large bronchi. So it is also on this after primary, then comes your secondary. So somewhat is also a large branch, but adeno on the tertiary, that may be on the distal part, and large cell carcinoma any location. So it can occur on the maybe in the primary bronchi or the distal bronchi or in the secondary or tertiary. Okay, so these are the images regarding the location of the cancer. Okay, the types of lung cancer. Clear? Now we have main types. In this image you can see the main types of lung cancer. So as I told you, 85 to 90% usually we have non-cell lung cancer. So this is the location for this, and usually arise in the outer region of the lung. Okay, and may look like pneumonia on the chest x-ray, and more common in women. But in the case of small cell lung cancer, it is around 10 to 15%, as I told you, and rapidly grow many sites within the body. So metastasis is very fast for this and strongly related to the patient with cigarette smoking. So this point I already told you. So these are the classification. Okay, clear? And you can see this patient with small cell lung cancer. This is a patient with small cell. This you can see, this is the metastasis you can see. Okay, so this is a x-ray of the patient with small cell lung cancer. Now what is the metastasis of lung cancer? So metastasis meaning is the transfer or progression of the cancer to the other organs. That can be through lymphatic vessels to lymph nodes, and that enters the distant organs, the nearby organs like liver, brain, and the second lung. If it is present on the right lung, then the maybe left lung can also be affected through metastasis. Okay, or by invasion to the nearby structure, that can be also possible. So benign lung cancer is not so common, rare. It's around 2 to 5% and of all primary lung cancer, and if it develops, then we have hematomas and adenomas. These are the benign cancer which are common. Okay, so this was the primary lung cancer. And secondary lung cancer meaning is that these are the tumors that does not occur in lungs, but it is metastasizes there from another organ. That the cancer is on other side, but that cancer can metastasize to the lung, and that type of lung cancer is called as secondary lung cancer. Okay, so common cancer which metastasizes to lungs are colorectal cancer, Okay, colon cancer, breast cancer we have, kidney cancer, melanoma, skin cancer, and the cancer of bone, osteosarcoma and all. Okay, osteochondroma. So these are the cancer, the sarcoma of the bones. So they are most common, which can metastasize or progress towards the lungs. And the heart cancers that developed after that are called as secondary lung cancer. Now symptoms we have shortness of breath, chest pain, and hemoptysis. So these are the and cough also. These are the four symptoms which are most common in cancer of lung, like dyspnea, shortness of breath, chest pain, hemoptysis, and cough. Okay. Other symptoms are recurrent lung sound, hoarseness of the voice. We will see dysphagia, difficulty in swallowing, superior vena cava syndrome. We will see shoulder pain and pleural pain. So these are the symptoms you will see in the secondary lung cancer. Okay, clear? Now we have another type of tumor which is called as Pancost tumor. So Pancost tumor is special type of lung cancer. This special type of lung cancer, and that is spatially localized in the upper part of the lung. So this is the most important point according to location. And in this we have brachial plexus paralysis, as brachial plexus crosses the upper part of your shoulder, and if any tumor or any type of cancer develops there, it can cause obstruction to those nerve vessels, and that is why there can be brachial plexus paralysis here. And the combination of severe pain in the shoulder, this is the first sign we will see, with damage to the nerve roots of C8, T1 and T2. So these are the roots of your brachial plexus, and that is why there is shoulder pain due to damage to those nerves. And we can also see Horner syndrome, atrophy of the internal muscles of the arms because due to no supply of nerve, and that are called as Pancostobias. These are the condition called, if we see Horner syndrome and atrophy both, then we called as Pancostobias. So then the condition is called as Pancostobias. In 96% of the patient with Pancost tumor has shoulder pain. So this is the first sign you will see in the Pancost tumor, and it is most common and the first symptom. That is the initial symptom you will see in the patient with Pancost tumor. Clear? And there can be unilateral sweating, redness of face, and that can lead to Horner syndrome, and nerve irritation by the tumor before invasion of the trunk. So these are the signs and symptoms. And in 5% of tumor can cause invasion of intervertebral opening and causing paraplegia. Okay, so paralysis can occur in 5% of tumor, which can invade to the intervertebral opening and can lead to paraplegia, injury to spinal cord. And 8 to 22% cases can lead to weakness and atrophy of muscles, paresthesia in hand and forearm. Okay, so paralysis of hand and forearm can occur in 8 to 22% of cases due to weakness and atrophy of the muscles. Okay, so this was your lung cancer. You can see the image of this Pancost tumor. As I told you, it is present in the upper part of the lung. So you can see this opaque part here. So this is present in the upper part of lung, and here somewhat your brachial plexus goes towards your forearm and arm and forearm. So if any tumor develops here in the shoulder region, so this can obstruct or block or press the nerve vessels, and that is why the innervations will be stopped and the atrophy of the muscles of the forearm can develop due to decrease in the nerve supply or inhibition of the nerve supply. Totally suppression of the nerve impulse to those part can lead to the atrophy of the muscles. So this is called as Pancost. There is a type of lung cancer. Thank you.